Good afternoon, everyone. Thank you so much for joining us today for our 2020 National Conference session, Telework Adapting to the COVID-19 Economy. Next slide, please. My name is Elise Gurney, and I'm a research associate with the Council of State Governments. I am also part of the State Exchange on Employment and Disability, or SEED team, an initiative funded by the U.S. Department of Labor's Office of Disability Employment Policy, or ODEP. I would like to thank ODEP and all of our SEED partners for making this session possible, particularly the U.S. Conference of Mayors Workforce Development Council, who partnered with us to bring you this session today. Our session today fits into the SEED initiative's larger objective, which is to work with states, territories, and localities to promote greater workforce participation and employment success for people with disabilities through inclusive policymaking. Next slide, please. Before we get started, I would like to draw your attention to a few housekeeping items. First, closed captioning is available for this session. If you would like to access it, please follow the link that we have just posted in the chat. To reduce noise during the conversation, all participants will be muted during the webinar. We ask that you please turn off your camera as well. Accessible PDFs of the webinar transcript and slides are available on our website, which is also posted in the chat. A recording of the webinar will be available on our website after the session. If you have any questions for our panelists or in general, please submit them through the chat feature. If you have technical difficulties or questions about Zoom, please also include those in the chat and CSG staff will get back to you as soon as possible. I will start today by giving an overview of telework and how it pertains to people with disabilities. Then we will hear from our panelists about current challenges and solutions around inclusive telework. And finally, we will move into breakout sessions to give you all the opportunity to meet each other and discuss your thoughts, efforts, and challenges around inclusive telework. Next slide, please. So first, as I mentioned, we will be discussing disability inclusive telework for states, state approaches to increasing access and inclusion. Next slide, please. This has been the focus of the SEED team's research for the last few months, and we are very excited today to announce that we are debuting this report. It is available following the link that has just been posted in the chat, and it provides a guide to policymakers in states to help them understand how they can develop more inclusive telework programs and policies. Again, you can access it following the link, and I will also provide an overview of the key findings right now. Next slide, please. So first, telework is our reality. I probably don't need to be telling you this. You are all very likely joining from home right now. But to ground this in data, telework was on the rise even before COVID-19. So part-term teleworking had increased by 115% between 2005 and 2017. And the number of people who had ever telecommuted increased from 9% to 37% between 1995 and 2015. And then, of course, we've seen, due to COVID-19, a substantial increase in remote work, from about 15% to about 50%. And note that that 50% number is definitely the higher end range. It's a high end estimate, and it also represents sort of the maximum share of individuals who were teleworking throughout the pandemic. Recent data from the Bureau of Labor Statistics has shown that the share of teleworkers has decreased slightly throughout the course of the pandemic. Next slide, please. So telework is our reality. It is also likely going to be our future. Roughly 40% of jobs are compatible with telework. In a recent survey, 75% of respondents indicated that they would like to continue working remotely, at least occasionally, post-pandemic, and 54% indicated that they would like to continue working full-time post-pandemic. In addition, over 40 states have implemented telework policies. That is a big focus of the brief that we've just published. I will also be profiling a few different examples of state telework policies in a moment, but I do want to highlight one right now to illustrate a point, which is the Utah's statewide telework program. We had the honor of having Utah's Chief Information Officer participate in a webinar of ours a few weeks ago, and he had mentioned that before the pandemic, when their telework policy and program was first implemented, their goal was to have 30% of the state government workforce participating. They've now updated that to be 70% after the pandemic. So again, that just really illustrates the staying power that telework has. Next slide, please. Telework can have a number of advantages, and of course today we're talking about inclusive telework, so we'll start by talking about the advantages that telework can have for people with disabilities. Something to note is that not everyone with a disability wants or needs to telework. And in addition, not everyone with disabilities has a job that is compatible with telework. However, for some individuals with disabilities, telework can facilitate employment. In particular, it can serve as a reasonable accommodation by changing the site at which work is performed. It can also remove workplace barriers. So for example, an inaccessible work site or a difficult commute. And it can also reduce discrimination. There's data to indicate that some people feel safer in a telework environment. We also have heard anecdotally from the Washington Department of Labor and Industry that among some of their employees who identify as being a part of minority groups, some do feel safer under new telework conditions due to COVID-19. So this has a number of advantages. In particular, telework can help states advance their disability employment or state as model employer goals. There are 30 states that have state as model employer initiatives, either through legislation or executive orders. And these are designed to increase the number of individuals with disabilities who are working within state governments. So again, telework can facilitate the hiring and retention of individuals with disabilities within state government. In addition, telework can increase innovation and organizational performance. There's a lot of research indicating that more diverse workplaces are more creative and innovative, and this translates to a range of different financial and operational outcomes. There's also a great report that Accenture produced in 2018 along with AAPD and Disability In that quantifies specifically the fiscal impacts that more disability inclusive policies can have within an organization. Next slide, please. So we've been talking about the advantages of telework for individuals with disabilities specifically, but these are just in addition to the normal advantages that telework can confer for both employers and employees. And of particular relevance to states is that telework can save employers $6,500 a year per part-time teleworker. And this comes from a number of different sources. The first and largest is lower real estate and operating costs. So this takes the form of, for example, less need for rental space, for parking space, for transit reimbursements. The General Services Administration of the federal government finds that they save $30 million per year in this alone. In addition, telework has been shown to increase productivity by around 13 to 22%. This is a study from Stanford. I will note that the data come from more normal telework conditions and not pandemic conditions. In addition, telework can produce lower voluntary turnover. In particular, it can better accommodate changes in an employee's living situation, for example, if they relocate to another city or state, and it can also increase morale, thereby increasing employee retention. In addition, telework can increase operational continuity due to emergencies. Research has found that current teleworkers, this would be before the pandemic, collectively saved their employers $1.7 billion a year by continuing to work just one additional day a year. And then in addition, telework can help address talent shortages. And this has been a big driver for a lot of states in terms of why they are rolling out telework programs. It's to help fill some of the gaps in their state government workforces. Next slide, please. I want to run through a couple of examples of where states have implemented telework programs and the benefits of those. So first with Tennessee, their Alternative Workplace Solutions program that has seen a reduction in sick leave of 37%, a savings of $6.5 million in the form of lower real estate costs, and increased productivity according to 60% of managers. In Utah, again, the statewide program that I had mentioned before, they have seen a 20% increase in employee performance, a reduction of 64,000 square feet in real estate, and they have also saved tens of millions of dollars. And then finally, the Washington Department of Labor and Industries alone has saved between $300,000 and $500,000 due to telework as a result of the COVID pandemic. And that takes the form of lower facility costs, lower utility costs, and lower printing costs. Next slide, please. So we've been focusing on the advantages of telework, but certainly the abrupt transition to telework has posed a lot of challenges for people. And some of these challenges can be particularly acute for some individuals with disabilities. So in particular, there is a challenge in bridging the digital divide. Only 25% of people with disabilities have high-speed internet at home compared to 42% of people without disabilities. So you can see that there's quite a discrepancy there. In addition, there may be challenges accessing reasonable accommodations. So if a reasonable accommodation was provided in the workplace, for example, an adaptive keyboard or a translator, that may not be available in a remote setting. There may also be a challenge accessing IT platforms. And then finally, managing mental health needs. From a survey earlier this year, 53% of adults said that COVID-19 has negatively impacted their mental health. In addition, according to the CDC, people with disabilities, including existing mental health conditions, may respond more strongly to crises like COVID. And we are going to talk about all of these in a moment. Next slide, please. So today's discussion is really focused on how states, local governments, and businesses can overcome these challenges that we've just gone over and ensure inclusion in telework amid COVID-19 and beyond. Next slide, please. And before we turn it over to our moderator and then our panelists, I want to talk a little bit more about what the SEED team can provide for you. So we've talked about the Telework report, which we've just gone over now. You can access it following this link here, or again, the link that is in the chat. This definitely provides assistance and resources, but we're also available to provide more one-on-one technical assistance, to provide bill drafting services, to perform programmatic analysis or more targeted research, and also to convene various individuals who are working on inclusive telework. So again, we are happy to help where we can with your inclusive telework efforts, and we will provide our contact information at the end of this session. So with that, I will turn it over to my colleague at the U.S. Conference of Mayors, Micah Kyler, who will be introducing our moderator for today's discussion. Thank you so much.
Hi, everyone. My name is Micah Kyler, and I'm a staff associate with the U.S. Conference of Mayors Workforce Development Council. Our moderator for today's session is Dr. Aaron Bangor. Dr. Bangor has dedicated his career to enhancing technology accessibility, pursuing this mission through both the private and public sectors. He has held various leadership and technical roles within AT&T, including as a co-founder of AT&T's first company-wide group dedicated to promoting accessible technology. Currently, he serves as chair of the Texas Governor's Committee on People with Disabilities and chair of Disability in Central Texas. He is a certified human factors professional, certified professional in accessibility core competencies, and holds 35 US patents. Dr. Bangor has served as a technical and policy expert for accessibility and disability issues with the Federal Communications Commission, Council of State Governments, various NGOs, and is active in national and international standards for accessibility. Dr. Bangor also holds a PhD in Human Factors Engineering from Virginia Tech. Thank you for being with us today, Dr. Bangor.
And thank you so much for that introduction, Micah. First, I just want to thank CSG and the SEED teams for putting together this session as part of the CSG National Conference in 2020. Not only is telework a very relevant topic in 2020, but I think it highlights many important issues that can support better employment outcomes for people with disabilities. The intersection of disability inclusion and technology has been a passion of mine throughout my career. And but telework and the technology that supports that, like any tool that people create, has the power to include or exclude. And that power is really held by not only the technology developers, but the implementers in organizations, whether that be public or private sector. So we need to have these kinds of conversations with a broad audience about how we are going to consciously include people with disabilities in these work arrangements, because otherwise we unknowingly exclude. So now it's my pleasure to moderate this panel. We have 5 extraordinary leaders in disability inclusion who have diverse perspectives on this topic of telework. So first we'll do some introductions, and then we'll get into the questions for the panel. First, we have Martha Jackson, Assistant Commissioner of Employment and Business Relations for the New York City Mayor's Office for People with Disabilities. In that role, Assistant Commissioner Jackson established NYC at Work, the first public-private workforce development program for New Yorkers with disabilities. The Mayor's Office for People with Disabilities works with other city agencies to ensure that New York City programs and policies address the needs of people with disabilities. And Assistant Commissioner Jackson previously served as Goodwill, New York, New Jersey's Director of Career Services for people who are blind, low vision, and deaf, and for Operation Good Jobs, Goodwill's employment program for veterans and their families. Assistant Commissioner Jackson, give you a couple minutes to tell us a little bit more about the work you're doing in the New York Mayor's Office for People with Disabilities.
Thank you very much, Dr. Ben. Thank you all for joining us today. I'm very happy to represent cities in this conversation. So yes, you're right. Just about 5.5 years ago, I did join the Mayor's Office for People with Disabilities. We call it MOPED, specifically to create a workforce development program for New Yorkers with disabilities. At that time, 80% of New Yorkers with disabilities were jobless and 35% living in poverty. And this is before COVID. So it was clear that we needed to really provide an alternative to workforce development for people with disabilities in New York City. But what role could our office play in developing such a program? You know, we believed our office was really uniquely poised to act as the convener, bringing together all the different entities that focus on workforce development for people with disabilities, the businesses, the providers and community-based organizations, colleges, both state and private, the state vocational rehabilitation agencies, and city government, because we knew we needed to take the lead on this. So we started with where are the jobs? And that meant understanding the needs of the business community. We held focus groups with businesses in high growth sectors and asked them, what are your challenges? And this is what they told us. We don't know where to get the talent. We don't have dedicated staff and resources like we do with other communities and populations, such as gender, race, LGBTQ. We don't have an understanding of disability etiquette or an awareness. Human resources will often stop the process at the door. And if someone does become employed, oftentimes that's a position that they will stay in. There's not much room for career growth. So with the support of the Poses Family Foundation, now understood, with the Kessler Foundation and the Craig H. Nielsen Foundation, we created NYC at Work, and we're able to hire dedicated staff in disability and in workforce development. We created a business development council that now has over 100 members. We've created a coalition of provider partners, and we work with our state VR and our provider partners because they have access to the talent pipeline. And with our city government, specifically with 55A, which is a program that allows qualified individuals access to city jobs without having to take the civil service exam. So it took us a little more than 2 years to put this all together, but I'm very proud to say that over 350 New Yorkers have been able to be connected to jobs, internships, and careers. And also proud too that NYC at Work was just named the Zero Project 2021 award winner for innovative employment in the public sector. So when it comes to the telemarketing piece, I think we're going to get into that in a moment, but that's really how NYC at Work came into being, and I'm happy to share that with you today.
Aaron, are you on mute? We're not hearing you.
Yep, I'm back. Thank you. Had double mute going on here. Thank you, Assistant Commissioner Jackson. Next up, we have Becky Kukula. Becky is the Director of the Disability Equality Index at Disability In, the leading nonprofit resource for business disability inclusion worldwide. The DEI is a comprehensive benchmarking tool helping companies build a roadmap of measurable, tangible actions toward disability, inclusion, and equality. Becky is a passionate advocate for diversity and inclusion on a global scale, helping to advance inclusion in schools, the workplace, and in the media. She is a founder of Disability in Media, which promotes positive disability inclusion storytelling through social media and she previously worked in the Equity and Inclusion Department at the Screen Actors Guild, American Federation of Television and Radio Artists. Prior to that, she worked at CBS Television Studios and Creative Artists Agency. Becky currently serves as the Little People of America Employment Chair and serves on the Board of Advisors for the National Center for Disability Journalism at Arizona State University. So welcome, Becky, and also you can spend a couple minutes just updating us on some of the things that you're working on.
Absolutely. Thank you for having me here today. I don't know if it gave it away in the bio, but I am a person with dwarfism, meaning I stand 4 feet tall as an adult. I am super passionate about this work because when I was first trying to find a job after college, I ended up sending out 1,000 resumes and went on 100 interviews. And every time I walked in the door, I was judged based on my appearance. And that's why I'm also super passionate about this teleworking world, because that's something that shouldn't matter. And I've been able to prove since then that I can do the work. So I started my career working behind the scenes in the entertainment and news media industry with a strong passion for changing what we see in the media, promoting more authentic portrayals, because people like me, people with dwarfism, have been historically portrayed in a negative way in the media, and that affects how people treat us in society. And after I spent a decade in that space, I kind of found and fell in love with the work of Disability In, formerly United States Business Leadership Network. And it was corporations coming together, sharing their stories and their challenges, as they all showed a bit of eagerness to be more inclusive of people with disabilities, which includes telework opportunities. This role that I've been in, running the Disability Equality Index, I've been in it for 3 years now, and our organization is completely remote. And we are remote because it's a way for us to be able to work from anywhere and also find the best talent and the people who are passionate about this space to do this great work. And now that we've been in a more remote teleworking world, we are trying to support our corporate partners. So our partners are corporations. A lot of them are within the Fortune 1000 scope, 500 or more employees. And we launched a whole group of webinars after we knew that this pandemic wasn't going anywhere anytime soon. And we got together different executives from different companies that we work with to talk about the challenges that they're facing as they're navigating this new COVID world. And that includes supporting your employees. So I think one of the biggest things is making sure that employees' accommodation requests were able to travel with them home. And a lot of corporations are very focused on making sure they can attract their customers when it comes to website accessibility, but you have to be mindful of potential employees or your current employees who may want to utilize those tools. So it's important to think about internal just as much as you do external. Any potential barrier is preventing people with disabilities from being able to be customers or work at your companies. And the index is a tool that companies take. It's a self-assessment for 500 employees or more. And they take this to try to figure out how they can do better in this space. And it's up to companies to hold themselves accountable and really stay committed to this work year after year. Thank you.
Thank you, Becky. All right, next up, we have John Paveo, the State Diversity Program Coordinator for Montana State Government. In this capacity, John also serves as the state's full-time Americans with Disabilities Acts Coordinator. John provides leadership and direction to Montana State Government in the areas of equal opportunity policy and program development, diversity and inclusion, the ADA, Family and Medical Leave Act, Persons with Disabilities Employment, preference laws and policies, and other issues. John spent most of his working life with the United States Air Force and has accumulated 25 years of experience managing equal opportunity compliance, diversity and inclusion, and conflict resolution. John holds a bachelor's degree in workforce education and development and both a master's degree and master's certificate in human resources management. He currently serves as a member of the Rocky Mountain ADA Center Region 8 Advisory Group. So John, thanks for joining us. And if you could spend a couple of minutes telling us a little bit about your role as State Diversity Program Coordinator and how that might support telework.
Sure. Thank you, Dr. Bangor, and thank you to the CSG and C teams for inviting me to participate in this panel today. Yeah, as Dr. Bangor read the bio, I have some different roles within Montana state government. And as he had mentioned, one of those roles is a state ADA coordinator, equal opportunity officer, diversity coordinator. So a number of different roles in that position wrapped up under that title. One of the things that's really important to me, one of the things I really enjoy most about my job is the ability to work with other state agencies to ensure that we are promoting diversity and inclusion, we are promoting equality, equal access. So my job, it really pertains to both the employment side and access to state government. So with that, I have the opportunity also to participate or draft, review, and provide input in a number of different policies related to my area of expertise. A couple of those policies that I think are really important are, we have an equal employment opportunity, non-discrimination, harassment prevention policy. Relevant to this presentation today, we also have a reasonable accommodation, equal access policy, disability employment preference, veterans preference, and maternity and parental leave policy. We're fortunate in state government to have a very robust and flexible telework policy, which I also have the opportunity to provide input on. And it's interesting because it's actually in review, being reevaluated and actually rewritten as I speak this morning or this afternoon. So again, it's one of those things where, you know, we have a great opportunity to learn from one another through presentations like this. I've learned so much just doing my, review, my preparation for this presentation, and things that are going to allow me to look at our policy a little bit differently to ensure that it is fully inclusive of people with disabilities. Another way I support telework is really through the assistance that I provide to state agencies. I mentioned earlier, or I may have mentioned earlier, that every agency in Montana state government has someone designated as an equal opportunity officer and ADA coordinator. So I work with those individuals, I work with the HR staff, with management, with the employee to ensure that we are providing effective accommodations for the individual. And this also includes telework. As we all know, telework sometimes prevents unique challenges, which we'll talk here about a little bit more. But with that, we do also provide some accommodations to ensure that our employees are effectively working remotely. So, and I look forward to talking about some of those different opportunities and learning a little bit more from our panel this afternoon. So thank you again.
And thank you, John. Our next panelist, I'm pleased to introduce, is Bobby Silverstein. Bobby is a nationally recognized attorney who has spent over 45 years advancing public policy to improve the lives of people with disabilities. Bobby is considered to be the behind-the-scenes architect of the ADA and numerous other bills, and he has pursued his work from every angle as an attorney advisor with the U.S. Department of Health and Human Services Office of Civil Rights, as a senior staffer in various U.S. congressional offices, as director of the Center for the Study and Advancement of Disability Policy at George Washington University Medical Center, and as a principal in the Washington, D.C. based law firm. Bobby is the legislative counsel for the C team and recently wrote a brief on state telework policies as they pertain to people with disabilities, as well as several briefs related to COVID-19 and its impact on the employment of people with disabilities. So Bobby, we're honored to have you with us today. Could you tell us a little bit about the briefs you recently written around both state agency telework and COVID-19's impact on the employment opportunities for people with disabilities?
Sure, Aaron, and thanks for the opportunity to share some thoughts with you today. As part of the SEED team, what we're always trying to do is to look at public policy issues from the perspective of state and local policymakers. What can we do to provide policy and technical assistance to make your lives easier? And with the COVID-19 pandemic in front of us, we said one of the things that the C team needs to do is to focus on telework and look at ways of making telework more accessible and inclusive of people with disabilities. And so what you have that was described to you earlier and hit the web about a couple of hours ago is a document, report, Disability Inclusive Telework Programs. And what this document does is starts with an executive summary. Policymakers are busy folks, try to include in the first pages of the key findings. Then there's a whole discussion that was already made reference to in terms of the business case for telework. The document then makes it clear what the Americans with Disabilities Act says about telework as a reasonable accommodation. So there's a section on telework as a civil right. And then there's sections when we did our review of all 50 states in terms of their telework policies, we found basically 3 topics. The first is what are telework policies in general? Secondly, telework agreements between the employer and the employee. And the third component was what we'll call implementation methods and strategies, how to ensure that telework is translated from policy to practice. And then what we did is we looked at examples from state legislation and state regs and sub-regulatory guidance around the country on how states have made efforts to make their policy, their telework policy, more inclusive of people with disabilities. And in all cases, all the examples referenced in the document have hyperlinks so you can immediately find the resource. So John, if you're in the middle of working on revisions, hopefully this document will provide you with a wealth of knowledge and examples so that you don't have to reinvent the wheel and you can steal from your colleagues. In addition, the C team updates basically every 2 weeks or more often where necessary, a resource guide of all the federal statements of policy and guidance on COVID-19 in the employment context that have implications for people with disabilities. So 3 hours ago, for example, I did the most recent update because yesterday the Equal Employment Opportunity Commission updated its guidance to deal with the implications of the civil rights statutes for mandatory vaccinations or vaccinations in general, and the implications also updating for telework. So not only do we have reference and links to the EEOC policy, but the Center for Disease Control and Prevention, the OSHA, Occupational Safety and Health Administration, and the Department of Labor, Food and Drug Administration, the Justice Department, Department of Transportation, etc. And these documents this document is also on the CSG website. So that's a couple of examples of some of the policy reports and guides we're working.
Awesome, thank you, Bobby. And then running the anchor leg for our introductions, we have Delegate Cathy Tran. Delegate Tran's family risked everything to come to America as boat refugees from Vietnam because this country has always represented hope, opportunity, and freedom. Now she's fighting for these values in the Virginia House of Delegates, representing the people of the 42nd District. As delegate, Cathy has passed legislation to expand access to healthcare, protect our environment, improve workers' rights, and make Virginia more welcoming and inclusive. Previously, Cathy devoted her career to ensuring all working families have the opportunity to achieve the American dream as a civil servant at the U.S. Department of Labor and as an advocate with the National Immigration Forum. Cathy graduated from Duke University and earned her Master of Social Work from the University of Michigan. The past president of her local PTA, she and her husband, Matt, live in West Springfield with their 5 children. Delegate Tran, thank you so much for joining us today. Can you tell us a little bit about the work you did in your roles with the Department of Labor and now as a delegate in Virginia?
Absolutely. Thank you so much. And I am thrilled to be here. I'll start with when I was at the Department of Labor and then talk about some of what I'm focused on as we're moving forward in Virginia. But at the Department of Labor, I served in a couple of roles, but I was with the Employment and Training Administration, which is a good partner to the Office of Disability Employment Policy around the Disability Program Navigator and other initiatives. And I worked as the Deputy Administrator for the Office of Workforce Investment, which oversees our portion of the DPN program. And then before that was the Director of Policy, Regulations, and Legislation for the Employment and Training Administration. So overall, national workforce policies and such, and focused on the workforce system. And since being elected in 2017 to the Virginia House of Delegates, I've been appointed to our state workforce board. So I love how my previous life and my current life are intersecting and continue to draw on that experience now. And I think as we in Virginia and probably across this country, everybody on this panel would agree, as we are looking at how our economy will recover and the steps that we take as states, as local governments, and as advocates to make sure that we leave nobody behind, and exploring all the different ways and opportunities and tools that we have at hand to make sure some of our most vulnerable communities and most vulnerable people are going to be connected and a part of the economic recovery. And I think it's really important when we're talking about people with disabilities that we're having that discussion around healthcare access, around education and an equitable education. We see a lot of the concerns coming up around students with disabilities and how remote work learning is affecting them, but then also in our workspace, and how telework, which I think so many of us, whether we have all of our different abilities, have been told in the past, like, it just doesn't work to telework. You're not as productive. We can't see you. We can't touch you. We can't understand, all the things that you're doing in that day. And how do you know it's going to get done? But clearly the last 9 or 10 months have shown us that we continue to work and we're able to do well. And so how do we make sure that we are providing the supports necessary and continuing to provide these opportunities, particularly for people with disabilities as we are recovering. In Virginia, we've done a couple of things, and before Bobby was asking me, he threw me for a little bit of a loop, but was asking me about some work we've done in Virginia. But we passed a law this past session to create, to kind of make more robust the responsibilities under our Secretary of Administration to develop telework and asynchronous or alternative work schedule policies for our state government. And one of the things that Governor Northam first did when COVID hit was to say everybody in our state government, as much as possible ought to be teleworking, and to use the state government as an example for the private sector. And then also as a part of this new law, it's to allow the Secretary of Administration to become a resource and provide recommendations when asked by the private sector. So opening that door a little bit. We've also in the past in Virginia had a telework tax credit, which was capped at $1 million a year for members of for private sector employers to apply if they were allowing employees to telework and who met certain criteria around equipment and accommodations and such. That tax credit has sunsetted, and so I had a bill to revive it that didn't pass. So I think that we'll have to figure out the conversations around how to promote telework and incentivize telework when we see that it's working now. And there's going to be some who wonder whether or not you still need the carrot at the end of the stick in order to have people approve telework. And so I think that's the big question around tax credit and those types of programs. But look forward to this conversation and to sharing more what's happening in Virginia. Thank you.
Thank you, Cathy, and thank you to all of our panelists for coming together today to talk about the landscape of telework and how that's impacting people with disabilities, not just in 2020 and into 2021 related to the pandemic, but what we can learn from this really to increase the inclusiveness of the workforce for people with disabilities. So first question, I want to pick up on something that Elise mentioned in her introduction, and basically what are the main challenges that employees with disabilities are facing amid the new remote work conditions. John, let's start with you and kind of what your thoughts are on that. Oh, do we have John? Let's move.
I was
oh, there
talking
you are.
there and didn't have my mic, and I apologize about that.
There you go.
So going back to a few things that Elise mentioned earlier, as we all know, there's a significant digital divide. Many people with disabilities may not have the equipment, the technology they need to be successful teleworking. They may be using antiquated computers, operating systems that aren't compatible with the software, with the programs that they need to do their jobs. They may not have the assistive technology that they had in the office environment. They may not be able to take that equipment home, or they may not have, again, the high-speed internet that they need to run that equipment. In fact, they may not have high-speed internet that's sufficient enough to use the software and the programs that they need to do their jobs, or even interact with their coworkers or with their customers. I know so many of us anymore are using Microsoft Teams, we're using Zoom, that aren't necessarily, compatible or the best tools for somebody with a disability. And in those cases, of course, we need to ensure that we are providing accommodations. But again, those are tools that we're using on a frequent basis, and tools that, again, a person with a disability may not have access to while working remotely. For many people, it may in fact just be cell phone connectivity. Many of us have cell phones in front of us right now. But again, people with disabilities may not have the cell phone. They may not have the internet connection. They may not have the ability to reach their coworkers or their customers. And with that, there's been a significant increase in the amount of stress, the anxiety associated with teleworking, either not having the tools and the resources to do the job. We've all heard concerns about feelings of isolation. That's a huge impact on individuals, both with and without disabilities. But again, on top of that, balancing work and family demands. These have all created significant challenges for people with disabilities and employees. One of the things that we've seen, or that I'm aware of as well, is the inability to separate work from home life. For many people, we wake up in the morning now, we grab our cup of coffee, a quick snack, and we're on our computers, and we work till 7, 8, 9 o'clock at night. We have family interruptions and childcare. We have taking care of homeschooling, all those different factors, which again increase the stress, the anxiety, and in causing a significant impact on our employees. So these are just a few of the things that I'd like to highlight, some of the things that I've done some research on, and some of the things that, again, Elise alluded to earlier, and I think we're going to be talking about in more detail. So thank you, Dr. Bangor.
Yeah, you covered a lot of ground there and teed up a lot of good conversations, good questions to follow up with. So one of the ones I want to pick up on is that concept of bridging the digital divide, not only in the hardware and software that needs to be used, but also just the connectivity that allows the telework to happen in the first place, whether that's from home or on the go. So, Assistant Commissioner Jackson, I know this is something that is particularly of an interest to you and something that you've been focusing on. Can you tell us a little bit more about the digital divide challenge and some of your experiences with that?
Sure. Thank you, Dr. Bangor. Thank you. John, you did cover so much of it. I guess I'll just take it from worker perspective right now, because one of the things I think we need to understand is even if a person is employed, it doesn't necessarily mean that they have a computer, or as John mentioned, they even have access to broadband Wi-Fi internet, or that they have assistive technology, or that the operational system is not outdated. So in New York City, there are approximately 1 million New Yorkers who have disclosed as having one or more disability. And about 1/3 of those folks are people that should be in the workforce. So for New Yorkers with disabilities, gaining access to computers oftentimes was either at their local library or at maybe a provider agency that we were working with, or a community-based organization. And this is before COVID. So now the libraries are closed and our community-based organizations are either closed or having very difficult time and are struggling to stay alive. So what do we do in this particular time where we can really connect people and understand that their needs? So it has been mentioned that people with disabilities necessarily don't have jobs that can transfer to remote work. So without the basic access to the tools and the infrastructure, how does that transition take place? And how can our office assist in providing quality training and doing it virtually and providing link, to the future jobs? I think about Bobby. It's 30 years since the ADA, and I'm just so happy that you're still working on this, because it has been 30 years and we're still having these same conversations. So we need to be able to provide people the access. And that means not just give someone a computer, but we've heard stories about folks having to go to the local pizza place or Starbucks just to be able to get access. We know that from our own workforce development program, that all of the events that we've had since July, really, more than 52% of the folks join through their phones. So we are really looking at two things. Number one, how do we get them the tools that they need? And how do you figure out when to stop doing things like it stops at certain zip codes? When broadband stops, where areas where people in low income and public housing live, you're not only robbing people the opportunity of advancement, but you have created a divide that's social, economic, and frankly, in this day and age, the opportunity to be able to lift all people up is something that's of real importance to us. We are working on a few initiatives in our office to be able to connect people, not just to jobs, but also to training, to laptops, to Wi-Fi and internet. And our city and our mayor under the de Blasio administration has committed to 500,000 new households in public housing and low-income housing to gain access to broadband. So our city is really working on these challenges, and it takes all of us to be able to make sure that this is successful.
Thank you, Martha. Next up, I want to go to Bobby and then Delegate Tran on a question around policy. So many employers, both public and private sectors, didn't necessarily have any sort of formal telework policy in place when the pandemic hit, much less those policies specifically addressing the needs of people with disabilities. And so, Bobby, I'm curious about your thoughts on why has that been a challenge for organizations to have that policy in place, and what effect has that had on people with disabilities, either who were in the workforce at the time the pandemic hit or people with disabilities getting into the workforce?
Well, let's start answering your question by focusing for 30 seconds on the word policy. Why do we have policies? We do it to prescribe appropriate behavior and proscribe inappropriate behavior. And if there isn't a clear policy on telework, then there is a very strong possibility of inconsistencies conflicts within agencies, and in many cases, supervisors and managers not knowing what's possible, best promising and emerging practices, and employees not understanding their rights. And again, for people with disabilities, this is particularly critical, that if they don't understand that telework is a form of reasonable accommodation, it may well be that the supervisor says, here is our telework practice. It's totally discretionary. We can do it if we want to. And the employee with a disability says, oh, I guess that's it. And there's no opportunity, when in fact, that isn't the case. So the challenges are really internal conflicts, inconsistencies, and denial of basic civil rights protections.
Thank you, Bobby. Cathy?
Thank you. First, before I begin my comments, I want to say when John had his, I was answering a little bit earlier, I thought he was describing my life as a remote worker, and you can probably hear some of my 5 children in the background right now in their remote learning environments. And so this is real life, right? But I think part of it, just even stepping back in terms of whether or not to have a telework policy and the idea of telework, even before the pandemic hit, I think we just had such a strong culture of being in person, right? And I think that was still something we were grappling with before we move into whether or not an employer or an organization had telework policies and all the complexities of setting that up. But I was reading a report that came out in January that said, from UVA, saying that in Virginia, if you took all the teleworkers in Virginia, we would be one of the largest industries if we were an industry of work. And that actually some of our most growing areas for teleworking were in our rural areas. And so in Virginia, some of our rural areas have significant broadband issues. There, for example, some are also areas that are all currently on well water, right? So there are a lot of infrastructure issues that were talked about earlier. And some of those infrastructure issues, not the water part, but the broadband piece actually also affects some of our suburban and urban areas still. And but so I found that report to be surprising. That that was in January. It was January 24th when it was released. And so we did the take now in terms of telework and where people are, I think it's grown. And so I think that this experience, by virtue of the nature of this pandemic, I think has shown what is possible in telework. And also, I think is a lesson in terms of what Bobby was saying, what are the things you have to consider in putting together a policy that is equitable for everybody, and understanding that for some, it is an absolute question, an issue of rights. And so I think that how do we use this and translate these lessons into something that's, I think, helpful to move forward is going to be the question for employers. Aaron, you're on mute.
Yep, remuting myself. Becky, I want to come to you next. So some of the reasonable accommodations that people received when they were working at the physical work site may not be available in a home setting. There may be other challenges for providing accommodations. I think about Bobby just started with is the right policy in place? Does everybody understand what the not only the obligation is, but what the benefit is to both the employer and the employee for supporting them through the reasonable accommodation process? So can you talk a little bit about the transition to predominant remote work environment, what some of the challenges may be for employers to provide those, and as well as how individuals with disabilities may have either successfully made or faced some hurdles in transitioning to remote work?
Yeah, I think if we kind of frame the conversation around the fact that if there are companies that didn't have a telework policy before then, or they didn't have, nobody worked from home, then everyone in the workforce who's working from home right now is receiving an accommodation. I think what we've seen a lot is that people who request not all people who request accommodations are willing to identify as having a disability. But I think what's really important is for managers to think about being more inclusive, especially during these times. So make sure you check in with the employee with the disability to see how you can support them even more than maybe you thought to check in beforehand. I think of how these times hopefully will be a lesson learned for talent acquisition when they go back to interviewing in person. Start the conversation with just how are you, get to know the person versus just diving into the questions without getting rid of any potential elephants in the room. And hopefully that's happening during remote interviews right now. I would say that it's really important to lean into the disability community, whether it's an employee resource group at a corporation. Make sure you're checking in with them to see if there's anything more you can do to support them. And then make sure that if you're setting up virtual meetings on any of these platforms that you're thinking about accessibility, you're setting up CART or ASL interpreting services, putting it out there when you're setting up virtual events that someone can request an accommodation. And there are many organizations that have recommendations on how to fulfill the request for those accommodation requests, like the Job Accommodation Network. It's important to make sure when you're sending files, Microsoft Office platform has an option where you can check accessibility when you're sending files to make sure that you're thinking about these things. Even if you don't think you're sending something to someone with a disability, go above and beyond because that person may just not have disclosed yet. And then it's important to just make sure that emails and social media in general are accessible, whether it's adding descriptions to photos or captions to videos, just so these employees with disabilities can have that same experience as everyone else. And I think it's just important to lean on organizations like ours to get guidance to make sure you're thinking about everything. Even when it comes to telehealth, it may not necessarily be related to your company, but it is related to the employee's experience to getting support with the benefits they need that are being provided to them by the employer. So you want to make sure that those platforms are accessible and that even vendors as companies are investing in new products and tools to advance the telework experience, make sure they're thinking about accessibility as well. So I would just say, always put the question out there, is it accessible before you engage in any purchases?
That's excellent. And Becky, I want to do a shout out for disability in, I think any one company, organization doesn't have all the answers. There's a lot to making sure that you've got an inclusive work environment for people with disabilities. And the great thing about Disability In is that it's a forum where businesses can learn from other businesses about what's worked, what hasn't worked. No matter where the business is on their journey to increase inclusion in the workplace, everybody has something to share, and everybody has lots of things to learn. And Disability In really gives a great forum to do that. And then on the state side, I would say CSG is the same, which is the executive director of the committee I'm on always says taxpayers should only have to pay for a good idea once. And where can states learn from each other what has worked, and maybe not copy and paste it exactly for their state, but really make some gain some insights, learn some things, leverage what other states have done well, learn hard lessons. It's best to learn the hard lessons from somebody else than having to bang your head against the wall every time, just like everybody else has. So CSG and the team there is a fantastic resource for our state officials to learn, and specifically in this case about inclusion of people with disabilities in the workplace. So the last one I want to kind of talk about in broad strokes around telework is certainly telework does change the social dynamic and how much contact we have with our coworkers. And in a large way, humans are very social creatures, and that can be a challenge, particularly for the mental health of ourselves and our colleagues. So I just want to open this question up for all five of our panelists to chime in on around what challenges are people having around mental health, and what are some of the ways that public and private organizations are addressing that head on as we continue to remain working quite a bit remotely, and again, continuing on, even after the pandemic.
This is Martha Jackson from MOPD. I think the most important thing that we all have to remember is that social distancing doesn't mean social isolation. In terms of what New York City has done, I have to say I'm really impressed. Our office, throughout the course of this pandemic, held a community call every week to be able to address the needs of the community from every aspect of it, from from transportation, the fear of getting on public transportation, to food insecurity, to not receiving their unemployment benefits. And we had the specialists or commissioners or directors of all the different agencies actually speak to the community and answer their questions. We've continued that, and we've found that the result has been that more people in our community are more aware of what our city is doing and also what our office is doing and how to connect with us. The other part of that is that throughout the course, the Office of Labor Relations in New York City has done an incredible job on providing all kinds of access to opportunities, from early morning yoga and meditation to helping with proper diet and exercise. We also have Thrive NYC, which is the city's mental health initiative, and the ability for people to connect on so many different levels has been made possible. What we found in our office is that, especially in the employment part of our office, is that our job seekers and also those who have been hired, were hired, and some who were laid off, have reached out to our staff at NYC at Work because they trust us and they understand that they can talk to us about things that are not job related, and we'll either listen to them and be calm, but we can also direct them to the services that they need. So we have a lot to offer in our city in terms of being able to provide direct access to mental health and mental health services. And we take that very, very seriously. So those are just some of the things that I wanted to share about what our city has done and how we've responded to the needs of the community, specifically those with mental health disabilities.
Excellent. Thank you, Martha. All right, let's, we've talked about some of the challenges. Let's, kind of start framing some of the solutions to really leverage telework to be as productive and inclusive as possible. Bobby, I want to start with you. Certainly there are many different civil rights legislations that, pertain here to the telework environment. Could you kind of set up for us, how that legislation does impact telework, both during the pandemic and once we get past that, and how organizations, public and private, can use that as a starting point to really foster a productive and inclusive environment in their workplace.
Sure. And CSG in drafting the Disability Inclusive Telework Programs report that we've made reference to several times, recognized how important it was to lay a foundation in our nation's civil rights statutes, both federal and state. So pages 3 through 5 of the document walk through the basic conceptual framework of ADA and comparable state civil rights statutes. Start with a notion that employers may not discriminate on the basis of disability against qualified persons with disabilities. Qualified persons with disabilities means a person who, with or without a reasonable accommodation, can perform the essential functions of the job. The word discrimination includes the failure to provide opportunities to people with disabilities that are as genuine, effective, and meaningful as those provided to others. And in the context of ADA, we have a disability phrase for what is meant by effective and meaningful opportunity. And that is the notion of a reasonable accommodation. And a reasonable accommodation includes various adjustments and modifications, including the provision of telework. And so that's the general ADA framework. But here are the key takeaways from a policy perspective. First, we're talking about that telework must be accessible to and usable by all folks, including those with disabilities. Second, if you have a telework policy, you may need to make reasonable modifications to that policy to ensure effective opportunity for people with disabilities. Third, even if you do not have a telework policy, or the policy is limited to certain job categories, under the ADA, you must provide telework as a reasonable accommodation. Again, even if you don't have telework for non-disabled folks, or even if it's limited to certain job categories. And that framework is important to understand. With the final policy is that accommodations should be a case-by-case basis based on an interactive process. And employers, managers, supervisors should not assume that a person with a disability wants or doesn't want an accommodation, in this case, telework. It is key to not assume all people with disabilities want telework. Some people do, and it should be determined on a case-by-case basis based on an interactive process between the employer and the employee.
Excellent. Thanks, Bobby. John, I want to come to you next. I understand Montana also issued a telework assistant grant earlier this year. Can you tell us a little bit more about that initiative?
Yeah, unfortunately, the telework assistant grants really didn't apply to state employees. It applied more to the private sector employers, or I should say private citizens, really. But with that, we've done a number of things in state government to ensure that we are accommodating people with disabilities. And I mentioned earlier that we do have a pretty robust telework policy that one of the things it allows is for our employees, with approval from their manager, to be able to take equipment home or use state-owned equipment. And that was one of the things that we saw occurring. It was pretty interesting because some people are practically taking everything in their office But again, it allowed people to take the tools and the resources that they needed. For example, people with disabilities, if they had some type of an adaptive keyboard, they were able to take their keyboard, assistive technology, monitors. Individuals were taking ergonomic workstations, which is interesting too. I talked with one of our ADA coordinators, and they were actually doing virtual ergonomic assessments. So, which I thought was really interesting, because many people are actually working from, their dining room table or from their countertop or whatever it might be, which again, depending on the individual's disability, that may be a challenge for them. So, talking about the mental health side of it, one of the things that we've really done, and we have an amazing employee assistance program. Our EAP manager and assistant have been very active, very proactive in going out to the agencies and offering their services, doing training for managers and employees on the different benefits that are available to them, especially as we talked about, because of the feelings of isolation, balancing the work life, again, not being able to separate their work from home. So all those things are taking their toll. So it's important for us to really get out there and let them know that these benefits are available to them, but not just to them. Anybody in their household is a beneficiary of that service. So one of the things that's really interesting is we had some of our agencies, or at least one that I know of, that created a mental health awareness team. So what they did there is they also provided training to employees and provided tools and resources to employees to ensure that, they are meeting their mental health needs. So again, health and wellness has been a big consideration. Another thing that's been really beneficial too, I think, for a lot of folks, and again, including those with disabilities, is that many of our managers have been very flexible in work schedules, time off, time for appointments, and again, allowing them to balance their life and their work needs. So a lot of stuff that I think has been really beneficial. We do what we call reasonable accommodation tracking on a quarterly basis. And some of the things that I saw, and it was really interesting, and I'm glad to see it, is that we're providing captions and CART and things like that through Zoom and some of the other platforms that are out there, speech to text, virtual ergonomic assessments, as I said. So a lot of good stuff that's going on. Again, we still have a lot to learn, and I think that's the value of this and the report that was put together that really focuses on telework. So again, thank you.
Thanks, John. Cathy, I want to come to you next. So what role can legislation play in helping shape telework policies within the states and within private companies, to expand telework and specifically think about telework as either a job accommodation or a way to ensure that people with disabilities have better opportunities in the job market?
Thank you. Clearly, remote learning has let out for the day. All coming now. My kids are coming on board. I wanted to, so two thoughts. I mean, legislation can help to incentivize telework. It can also help to provide parameters by which the teleworking agreements need to meet either the ADA or beyond, right? To specify kind of the parameters of different telework agreements, of doing assessments and things like that Bobby was talking about earlier. But I want to provide a couple of cautions as you're working on legislation in your advocacy. So sometimes you can have legislation, here, Matt to the rescue. You have legislation that is a little bit more broad. For example, set up a telework tax credit program. But sometimes you could have it where you put a lot into the legislation because you feel like the agency might not go in the direction you're hoping they would go in. And you just have to be careful in that crafting, because the telework tax credit program that we had in place in Virginia in legislation, in our code, was actually really prescribed. They had to do employers had to apply at a certain time period within the tax year and things like that. And it was actually really cumbersome. And so then they got very little uptake on this tax credit. So when it came around as legislators were reviewing what tax credits are on the program, what usage do we have? Are they needed or not? People were like, well, nobody's actually using this telework tax credit. We must not need it. And so that was part of the argument for doing away with that program. I did vote against that. But, so it became very circular because it was embedded into our code that it was really hard to use and nobody used it. So therefore we didn't need it. But so then to bring it back, then when I wanted to bring it back, people said, well, now there are lots of people teleworking and we only use tax credits to kind of incentivize behavior. So you might not need to really incentivize it anymore because it's happening. So I think if you are newly establishing different types of programs to promote teleworking, just kind of think through what you want in code versus what you're, and sometimes it's absolutely necessary to be a little bit more prescriptive. So that's one piece. But the other piece, in addition to legislation, is working directly with an administration. And sometimes, if that administration is open to it, they might be able to use their regulatory or policymaking abilities to help push and nudge in a certain direction in terms of opening up telework here. So I mentioned earlier, Bobby and I were just chatting over the text about, that our Secretary of Administration in Virginia is now responsible for not just, more robustly developing a telework and alternative work schedule policies for state employees, but to also be a resource for private sector employers. And so I'm actually going to share with them some of the inclusive telework policy resources that were in the link, so that in their work as a state agency, is to kind of absorb that and to share those best practices as well. And then I just want to flag, there might be commissions that would, for whom this would be a good topic to tackle and make recommendations to the governor and a state legislature too. And so there are lots of different ways, I think, within the state government structure to be able to push for change. So looking both, not just like changing the law, and in some cases that's absolutely the direction to go, but there might be other levers to push as well. Oh, you're still on mute, Aaron.
Yeah, I definitely get the prize for not being able to click the button today. We've got 2 or 3 questions left, for prepared questions for the panelists. So if the audience has questions they want to ask of our panelists, go ahead and make sure you send those in, and we'll reserve some time here to cover those right after we're done. Martha, I want to come to you next and talk a little bit about how New York City is expanding accessible telework, and maybe also speak to how local governments in general may be able to do that. Not just at the state level, not just private employers, but the local governments that you're familiar with.
Sure. So in terms of what we are doing, number one, I have to say that the city agency that kind of helped with the transition for all of us to go remote worked very closely with our office to make sure that they developed a reasonable accommodation packet for folks who were going to work remotely, as well as coming back into the office when that will happen. So what we're looking at right now is what can our office do, and who can we work with to promote? And I think one of the things that we found in this collaborative approach that we have at NYC at Work is bringing the entities together. So business, the provider agencies, and city government to be able to make a difference. We're actually doing a pilot project, which is going to start in 2021. And this is a really good example of not just city agencies, but the private sector coming together. We are working with Microsoft and also with the Mayor's Fund to Advance New York City, along with one of our corporate partners, Global Brands Group. They have donated laptops to us. We have purchased laptops. We've gotten 500 licenses from Microsoft to start this process. And we are connecting our job seekers to technology, making sure that they have the computer that they need with the Wi-Fi and access to internet. If they are not currently working, what we want to be able to do is help them find a job that's going to lead to sustaining wages. So making sure that we are able to connect them to all kinds of training based on their skill set, based on their employment goal. We are also making sure that because of this transition, we're engaging with other city agencies, including the Office of Financial Empowerment, to be able to understand what happens to someone's benefits when they go to work. So really looking at the whole picture, so to speak. And then in terms of what other cities can do, New York City MOPD is taking the lead on a brand new initiative called Empowered Cities. And it involves Boston, Chicago, San Francisco, and Los Angeles, with New York City in the lead. And we are really looking at the issues that face municipal leaders right now. And so we're focusing on a few of them. We're focusing on COVID-19 and emergency response. We're focusing on employment, affordable, accessible housing, access and equity, and the digital divide. And so this pilot project that we're working on, we hope we're going to be able to share with our sister cities and start looking at how collaboratively we can really change the landscape.
Thank you, Martha, for that insight. Becky, I know disability and in particular, you work closely with business community around accessibility and workplace inclusion. So, what are some of the common themes and steps that employers have been taking in 2020 to help ensure that people with disabilities are being actively included in the remote work environment and the setups that companies have adopted to enable that?
Yeah, I would just say it's that check-in, making sure people have what they need. It was an abrupt switch from working in the workplace to working at home. But I would say what is the most important to me is, and to the work that we do, is to not assume that every person with a disability who's working wants to work from home forever. So we need to be mindful as we start planning return to work that we're also being inclusive of people with disabilities. We don't want to go backwards when it comes to building accessibility. So I think it's those companies that are really being intentional about surveying their employees. One of the best ways to do that is a cross-functional disability group, the employee resource group or affinity group. Get people's thoughts on how they're feeling and what they want their plan to be. We think it's very important to allow for flexible work options if people do choose to continue to work remotely, but we want to make sure that people with disabilities aren't left out of any of the plans. So I would say those companies who are intentional about making sure they're not leaving anyone behind are those that are advanced.
Excellent. And kind of a follow-up question on that. So the reasonable accommodation process is very much about the interactive dialogue, and also knowing what options are even available that might support the productivity of the employee with a disability. What are some things companies are doing to sort of transition that interactive dialogue to a virtual setting, and maybe businesses are familiar with certain accommodations when they were provided on the work site, but how are they learning about other types of job accommodations that may be particularly relevant for the telework environment?
I think it's just really important for them to be in touch with, I know someone shared the link, the Job Accommodation Network, to understand the vast variety of different accommodations that people may ask for. And it's also important for employers not to be so caught up in, oh my gosh, it's going to cost so much money, we can't do this, because a lot of accommodation costs can be free or they may be less than $500. It's important to not have that be a barrier and assume that you can't do things differently. And the biggest piece is when you're working with vendors to try to figure out which remote platforms you want to use for your business, they need to be accessible or you're going to leave people behind.
Excellent. Thank you, Becky. Delegate Tran, I want to come back to you and ask you about, there are certain types of ways of messaging employers around inclusive workplaces and particularly around telework environment that have been effective for either across all audiences or specific to certain audiences. Maybe some messages work better for some than others.
I really appreciate that question. I think particularly when I talk to employers about worker protections and worker rights, it's how it's good. What's good for workers is good for employers and helps to grow their businesses and help to grow our economy. When you're talking to legislators, I think depending on who, it's a similar message. But I wanted to take this point and just take this opportunity to also talk about why it's important to build broad coalitions, right? The issue around when we were talking earlier about the infrastructure that's necessary for telework, for people with disabilities who are trying to telework, part of that is access to broadband. That's not an issue that's just limited to this conversation only. We all know that, right? So how do we make sure that when we're talking about some of these problems that we are building the broadest coalition possible? Because sometimes a legislator, this particular group of individuals might not be somebody's top of mind population to support, but they can support, really wrap their arms around, hey, I need broadband access to help the kids in my district remote learn, or, for example, right? And that is also really beneficial to you. And so as an advocacy community, we can continue to fight for people with disabilities to have broadband to telework alongside somebody who's fighting for broadband for school access, for example. And I think how we think about that, and that's how I approach my own legislative policy work when I'm trying to push my policies forward, is trying to think about those types of coalitions, because each partner is going to have a little bit of a different message and a little bit of a different angle to come at an employer, to come at a lawmaker to make those changes. And I think that is, the more the merrier to me, at least, and that I think the message here and the importance here for people with disabilities won't get lost, hopefully, in that conversation, but will help be augmented. But I think, but broadly, why it's good for growing our economy, if everybody who wants to work is able to work in a way that's best for them and meets the needs of those employers, is how that's a win-win. And then there's some who really are really loving the data, and if you have that data to show that for your particular state, or if you have a data for another state, if you don't have it for your own, right, but for another state, to be able to say, hey, look what's happening in some of our surrounding regions. We want to be able to compete in our region. For us in Virginia, it's the Mid-Atlantic. This is what we've got to do. The data is helpful, and also the personal stories. And that, for me, that moves me. But so the personal stories of people who've been trying to figure out how to telework and contribute and can't, or if only they had that particular accommodation that their employer is not thinking about, for example, and can help make a big difference. And I think those are the three pieces: personal stories, data, and that research, and talking about just how it's a win-win for all of us. But building that broad coalition is something I would really encourage.
Yeah, excellent. I love that message that, this is not a zero-sum game. This is a way to make everybody better off at the end of the day. So I'm going to do.
Can I just add one thing?
Go ahead, Cathy. Yeah.
I think, and even when I talk sometimes amongst my own caucus mates, I'm a Democrat, so amongst my own caucus mates in Virginia about worker rights and worker protections, and this is what I see this issue as fitting into that larger conversation. I get a lot of pushback, particularly from small business owners, and about the cost and about the stresses on a small business, and I think the job accommodation network, understanding that there are resources to help out them on the employer perspective for accommodations, but that this is under the ADA, like this is a must do and not a nice to do, I think is also really important. But if there are ways to help point out some of the existing resources that Becky and others have brought up already, that I think would be helpful for that conversation as well.
Cathy, it's Martha. If I could just add to that, especially for small businesses, oftentimes the state vocational rehabilitation agencies become a really good partner when it comes to providing even training or equipment for reasonable accommodations. We found that, especially for small businesses, to be a great asset.
Erin, could I take a minute and to try to share some of the core recommendations from the report or policy options?
Yep. Go ahead, Bobby.
How to take a telework policy and make it more inclusive to people with disabilities. This is just a couple of quick big picture. And again, the report was done based on a review of all of the state telework policies, as well as all the ADA policies that states had adopted. So if we want to make policies more inclusive, one of the first ways is to make sure that the provisions that implement the state civil rights statutes and the ADA do not only say reasonable accommodation equal telework, and in one sentence, but there is ways of making it crystal clear what telework means as an accommodation, so that the EEOC, for example, has a whole document on work at home telework as a reasonable accommodation. So there should be references to the ADA or the state civil rights statute, and not only have one sentence, but expand on what that means and how to do it. Job Accommodation Network has. Then when we look at the generic telework policy, most telework states have the same statement of purpose. And that purpose is it's discretionary with the employer. Well, if a supervisor just reads that sentence, they will say it's discretionary only with the employer. And that means you forget about the fact that it's not discretionary for the employer for certain people who need telework as an accommodation. The telework policy in general has eligibility and participation rules. But if they don't recognize there's a modification to those rules that's necessary, the supervisor or manager may not proceed and understand. There's notions of what should be in a telework agreement. Well, that agreement for non-disabled folks would be a perfect model for the interactive process for telework for people with disabilities. Then you have management of the telework. Are the supervisors trained about the ADA component? Are employees trained about their rights? Do folks know about how to make platforms accessible? There's in page 10 of the document, there's a reference to the Partnership on Employment and Accessible Technologies, the P project. They have unbelievable resources on how to make sure that the platforms are accessible for everybody. So that's the purpose of the document, is to provide example after example of what states have done to make sure that their telework policies are inclusive. And I'm just giving you a couple of policy options.
Yeah, just a proverbial tip of the iceberg there. And I think we'll wrap up there with that note, which is, organizations should not feel like they have to start from scratch. There are lots of resources out there. That's not and that's to be done in parallel with obviously talking with your employees with disabilities. Becky mentioned the employee resource groups and affinity groups within an organization can be a great asset. So whether it's telework or anything else about increasing inclusion in the workplace, there are a lot of resources available, and Disability In, CSG are just two great places to start and can help you connect with how to do not only accessible, inclusive telework during the pandemic, but to learn the lessons now and apply that and not go back to bad habits, but to learn from this experience and be better at the end. So with that, I'll turn it back over to Elise for the next part of our webinar today.
Thank you so much, Dr. Bangor. Thank you so much to all of our panelists for sharing about the initiatives that you all are working on, the challenges that you're encountering, and sort of building that vision for a more inclusive future around telework. So appreciate everything that you've shared today. We're moving into the final component of our webinar, which will be breakout sessions. These will be 25 minutes long, moderated by a member of the SEED team. You'll be receiving an invitation in just a moment to join those. The objectives of these is to give everyone an opportunity to meet one another, to discuss what you've heard today, to share any initiatives that you or your organization is engaged in around inclusive telework, and to discuss challenges that you've encountered or expect to encounter around implementing inclusive telework. We'll spend the next about 20 minutes in these breakout sessions before reconvening for some final remarks. Note that anyone who indicated at registration that they would like closed captioning will be placed into breakout session number 1, which will have live captioning. If you did not indicate that you need closed captioning, but you would like to access it during the breakout session, just send us a message through the chat and we can accommodate that. So again, in a moment, you will see a box pop up on your screen. Simply click join and you'll be placed into that breakout room. right, welcome back everyone. We're going to wrap up now. Thank you all so much for participating in today's webinar. Thank you to our moderator, Dr. Bangor, and our panelists, Assistant Commissioner Jackson, Becky Kukula, John Paveo, Bobby Silverstein, and Delegate Tram. If you have any questions that you did not get a chance to ask, or if you would like to connect further, please contact myself or Dina Klimkina at the email addresses that we are going to post in a moment in the chat. CSG has one final virtual national conference session for 2020 entitled What the Election Means for the States. It will be held tomorrow from 2 p.m. to 4 p.m. Eastern Time, and we'd love for you to join us. Finally, I'd like to thank all of our sponsors for supporting CSG's 2020 National Conference session. Thank you all again so much. Don't hesitate to reach out, and we hope to see you again soon.